I understand that there will be more aged care facilities which will be built in the near future. As I myself is also an elderly, and of course many more, we are definitely among ourselves looking forward to more good, healthy years. So could Mr. Minister share your thoughts with us on the aging in the community, and how do we get greater support for such amenities? Thank you.
Thank you. Thank you for raising this issue. In fact, it's a very important issue that has occupied a significant part of the time and efforts within the Ministry of Health. How do we address the challenges of an aging population? Like you rightly pointed out, Singapore population is aging, and aging will not stop. It will continue. Even with cosmetic and so on, we may appear younger, but in reality, you and I know the aging process will continue. So this morning, when I visited the garden, one of the elderly residents came to see me and said, Mr. Gan, do you know the solution to aging is to invent an immortality pill? So I told him, actually, that's not the solution to aging, because you live very long. In fact, immortality pill, you live forever, and you age forever is going to worsen the situation. So the solution is not immortality pill. The solution is we want to encourage, as I said, the primary objective is encourage healthy living. So stay healthy, even as you live longer. But we do understand that even as much as we try, there will be occasions when we fall sick. And as we get older, we tend to fall sick more frequently, and we need to have care. And therefore, the government will continue to invest significantly in healthcare facilities. For the aging particularly, we are going to invest over the next 5-6 years up to $500 million to build aged care facilities in different parts of Singapore. And we will not stop there, unfortunately. I think we will continue to have to build more facilities, even beyond the various facilities we announced a couple of weeks ago. Even nursing home, for example, we announced 10 of them. We will not be stopping at 10. Very soon, we will need another 10, and even beyond that. So at the right opportunity, we will announce additional facilities. Once we finalize the planning, and more facilities will be announced. And I do look forward to the continued support from all sectors, including particularly the community. We hope that the community will support these facilities, because it is important for us to build these facilities within the community so that the elderly can be looked after in a place that they are familiar with. They have lived here for many years. They want to continue to be in the community. And it's also important for them to be near to their loved ones, their family members, so that they can visit the elderly regularly. I visited one of the elderly nursing home not too long ago, Manfat Tong, and there was a tenant, a patient in the nursing home. His son visits him every day. And can you imagine if the nursing home is somewhere 10-20 kilometers away and the son has to visit him every day? It's not possible. So she was very grateful, and the son was very grateful that the nursing home was where it was. So I think it is important for us to always think about our loved ones. How can we create more convenience for them so that they can age peacefully and also age with dignity, gracefully within the community? We must make these elderly feel welcome and not make them feel that they are something that is a liability to us, something that we don't want them around. These are the elderly that have spent a lot of effort helping us build Singapore into what it is today. So let us work together to extend a welcoming arm to them to say, please, we welcome you into our community, and spend your time with us, and we will continue to support these facilities. Even in Manfatong, there were community organizations, VWOs, grassroots organizations that visit them regularly, organize activities for them, take them out for visits and so on, keep them engaged in the community. So it is part and parcel of the role and the duty and responsibility of the community to continue to support and serve our elderly. And this will shape the society that we will see in 20, 30 years' time. So this is also an important part of the national conversation that we are starting, how to come together to have some form of consensus of what kind of society we want in 20, 30 years' time, what kind of values do we want our children to inherit. So this is a very important part of how to build a gracious society. So I look forward to your continued support and to the support of the rest of the community for us to build more elder care facilities for the convenience and the benefit of our elderly among us. Thank you very much.
Further to the uncle question and your answers on the facilities for the elderly throughout Singapore, I read from newspaper that it comprises 10 nursing home, I think 39 senior care center, 55 senior activity center. I've been living in Potong Pasir for 37 years. I have friends, very good terms with all the uncles. They watch me grow up, married. I think it's an excellent plan. But Potong Pasir population is aging. Are there plans in the future to build such facility in Potong Pasir? Thank you, Mr. Gan.
Thank you. The answer is yes. Even if you are not included in this 10, it will be coming, because over time you will find that there will be more and more nursing homes that needs to be built. And I made a statement a couple of weeks ago that our strategy is to make every neighborhood an elder-friendly neighborhood. So wherever you are, wherever you live, wherever you stay, you will find elder care facilities within the neighborhood. Whether they are daycare facilities, whether they are nursing homes, whether they are medical facilities, or even social facilities for elderly. We have to build all these facilities because all of us are aging. And just to remind you that in 20 years' time, I will be the one that is in the statistics of those that are aged 65 and above. In fact, I will be way beyond 65. So we are talking about elderly in 20 years, 30 years' time. We are talking about ourselves. In that time, all of us will be the elderly. Maybe you, sir, could still be below 65, and I certainly hope you are. Thank you very much, and we look forward to your support.